Why hello there! Dental students from UF here, and we'd like to talk to you about the most important do's and don'ts of being a dentist. In our society, dentists are respected professionals. In order to make sure that we keep this respect and trust of our patients, the American Dental Association, the oldest and largest organization of dental professionals, crafted a set of ethical guidelines for its members, that's us, to follow, just in case we find ourselves in a bind and need some direction to make sure everyone is treated fairly. There are 5 ethical do's and don'ts. Let's talk about them.
The first and only don't on this list is non-maleficence. In layman's terms, it means do no harm. As dentists, we want to take every measure we can to keep our patients safe. How can we do this? First, we must be educated. Secondly, if we aren't sure about a case, we should always refer or ask for a consultation. We always want to be sure when working with a patient.
Now for the do's. Oppositely to do no harm is the principle of beneficence, or rather, do what is good, not only for your patient, but also for the community as a whole. As dentists, we are equipped with a special set of skills that allow us to serve our community. Engaging in volunteerism and research for the betterment of society is a must. Besides, we should want to help, right?
Another important principle is justice. As healthcare professionals, it is our obligation to be just or fair. We shall not deny treatment based on sex, gender, race, ethnicity, or socioeconomic status. We always strive to provide every patient with the best treatment and create equal access to care for all.
Veracity. Always communicate truthfully to your patients. To avoid misunderstandings, it is important for you, the provider, to be honest with your patients. Always communicate all relevant information regarding the patient's dental situation that will allow them to make a rational decision. Never attempt to deceive or withhold information from your patients that may potentially have an impact on the decision they make.
This brings us to our last principle, patient autonomy. It is the patient's right to make their own decisions regarding their dental health at all times, without us, their dentist, trying to force them in any direction. How can we best achieve this, though, keeping in mind that what we want is best for our patient? It is important that we educate our patients and allow them to make a decision based on true and relevant information. By doing this, we can let them know that what we truly want is best for them. It shows that we care, but at the end of the day, the patient should always be free to make their own decision. Once they do, we can then follow the other 4 principles that we talked about to take the next best step forward in their treatment.
So you see, the ADA Code of Ethics is a really awesome set of guidelines that leads smoothly from a question to a solution. By following the 5 principles we spoke about in this video, you're sure to be one awesome dentist. If you'd ever like to read the ADA Code of Conduct in your free time, please visit www.ada.org. Click the About Us on the top of the page, and then click the Ethics and Professional Code of Conduct tab on the left-hand side. Thank you so much for watching and letting us share this information with you. It's been a real pleasure.